Well, just want to thank everyone for being here tonight and kicking off our discussion for the evening. I'm going to turn it over to Rita Walker, ARCA's board president.
Good evening, everyone, and welcome to tonight's training. If this is your first time attending an ARCA-sponsored training, I want to let you know one of the real bonuses of your participation will be when we get to the small group sessions. That provides us all an invaluable opportunity to meet and connect with other board members from regional centers across the state. Tonight's training, I'm sure, will be fabulous, as the ARCA-sponsored trainings always are. And so I'll turn it over to you, Amy.
Great, thanks, Rita. As I often say at the beginning of all of these, really appreciate the work that board members do and appreciate you giving of your time, not only to your regional center boards, but to be here with us this evening. Regional center boards are really what sets this system apart and allows for the system to operate as it does, with local control and informed by local needs. So tonight's topic is services for school-aged individuals, and we have some great speakers lined up, but wanted to set the stage a bit by taking a look at a video that was produced by Harbor Regional Center about a young boy named Noah, to give you a sense of he and his family and his needs in his life. So bear with me while I try to share my screen. Hang on just a moment. Oops. And one would think that I would have it all set up and ready to go, and one would be mistaken. Let's try that again.
One, two, three, four.
Noah's in second grade in Golden Elementary, which is in Placentia, and that's in North Orange County. We've moved since the last time, and he started there in kindergarten, and he is fully included. And he's received a lot of support. He's had a teacher's aide, Debbie.
Yeah, another done.
What did you forget?
No.
Yes.
She's been
All by
a
yourself.
guiding force for him the entire time. And then it helped because when he first started, his older sister was in that school.
And we were able to transfer him into that program, Golden, for kindergarten. And we met with the principal at the time and thought, well, should we give full inclusion a shot? Because his preschool teacher thought you should just consider it, as opposed to him entering into a special day program. And we were a little bit worried, but he had a good foundation. He knew some of his ABCs. He can count a little bit.
Tub.
Tub. We take a bath in a
Tub.
tub. Excellent.
It was at the end of first grade that we met with the IP team, and because academically the kids in the typical classroom started to really take off, and
Yes.
Noah wasn't able to keep up with the mainstream curriculum, they thought it best that we consider putting him 50% in a fully included classroom and then 50% in a special day class, which is what he currently has in his second grade program.
Good. Very good.
The positive thing about keeping him in a full inclusion class was, again, the whole social interaction and working with his peers and them understanding that, Noah is basically a kid like us. He just has some special needs, or he just has some slight delays. And so as a result, in this entire school, a majority of the people, now know Noah, and they treat him respectfully.
You walk around campus on back to school night, and everybody was saying, "Hi, Noah. Hi, Noah." He has so many friends.
Yes, he
And
does.
we were looking at the yearbook, and he was pointing out all these people that he knows. It's quite amazing. Overall, been a very positive experience for him at Golden.
What do caterpillars eat? What do they eat?
Food.
What
They
kind of
usually
food?
do
What's their
some
food called?
morning activities, a
Eggs,
routine where
milk?
they
Now
will
look.
do the days of the week and things like that. Other activities, I guess he does some social studies and art and some history. But when they do math and language arts, they usually have him do some other work.
2,
So he has his own parallel curriculum, and he is actually doing quite well with that. In fact, his aide cracks me up and she says, "You know what he told me today?" He says, "Okay, here's your work and here's my work. Now you go do your work. I'm going to do my work." So he has quite a personality.
You'll do it. Zub.
Good job.
Thank you, Noah.
But he loves school and he loves learning. He loves challenges, and he's doing quite well in school.
Up, head up, and down. Go down.
He has occupational therapy, and they work on special skills for him because he still has some fine motor issues.
There you go. Big movement. Okay, big movement.
He does have adaptive PE, which is to help him with some basic gross motor functions, and he's still having speech therapy as well.
Come on, Zachary.
When we moved to Placentia, we found out that there's quite a few activities for kids with special needs. Noah started out in a program called Top Soccer, which is fabulous. We also found a group called Hoop Stars in the area, and he plays basketball with other kids with disabilities, and he loves that. One year during their March Madness festival, he won second place in the free throw competition. So we're really proud of Noah. He also plays in a group called Challenger Baseball, and currently he's playing Little League T-ball. He hits off the tee sometimes, but it's mainly a T-ball for him, and he likes to suit up and play with the other kids. He's trying his best to do what he can to learn, and his communication is really off the charts for us.
And what do you enjoy doing?
Reading.
Reading. I know you love reading books. What's your favorite book right now?
Tarzan.
Okay. So we really appreciate when families allow us to tell their stories and show the reality that they live. And what we're here tonight to talk about is services to school-age children. And we really appreciate having 3 regional center staff here with us to talk about first, what does eligibility look like for this population? Second, what do services and supports look like for this population? And third, as people look towards exiting the school system and moving into adulthood, what does that look like for them? So without further ado, I'm going to turn the discussion related to regional center eligibility over to Dr. Carlo D'Antonio from North Los Angeles County Regional Center. Dr. D'Antonio?
Hi, everybody. Amy, thank you for the introduction. And let me share my screen. Hopefully this will work. And we're sharing. So you guys see it correctly? Yeah?
Looks good on this end.
Okay, good. Okay, okay. That's good to know. Okay. Well, yes, well, I'm the Director of Clinical Services with North LA.
We have just lost audio. Dr. D'Antonio? Amy, are you still with us?
I'm still here. But it appears that Dr. D'Antonio froze, and I wonder if for the sake of time, we should move on to the second presentation and then come back to eligibility after. What do you think, Daniel?
I agree. I'll contact Dr. D'Antonio offline.
Okay, sounds good. So that was just the beginning of Dr. D'Antonio's presentation, but always appreciate that regional center staff are so flexible and willing to jump in as necessary. So now to discuss with you services and supports for school-age clients, we have Cesar Garcia, who's the Director of Client Services from Westside Regional Center. Cesar?
Thank you, Amy. Daniel, thank you as well. Appreciate the invitation and being able to participate with everyone here this evening. So good evening to everyone. So all this will definitely make sense, once you hear Dr. D'Antonio's presentation of how one becomes eligible for supports and services at the regional center. So tonight, specifically, I will be presenting on services and supports for school-age children. So once eligibility has been determined and an individual is participating within the regional center. Okay, so services and supports. Individuals typically are eligible for services based on their unique needs that are related to their developmental disability. Services are put in place to support outcomes that one is hoping to achieve. Some of the services we're going to discuss tonight are based on an individual's age. And all of the services that the regional center provides must go through the IEP process. So services must be requested through the individual program plan, not the IEP, I apologize. And that is critical. So the IPP, some of you may or may not be familiar with, it is a contract between the individual and family and the regional centers. This document highlights the uniqueness of that person, the strengths, what they hope to be achieving and working towards. And then services are outlined within this document, in support of the individual and the outcomes they hope to achieve. So service coordination. Service coordination is one of the most important services regional center provides. Some people may not consider this to be one of the services, but it really is. Service coordinators are the primary contact that an individual and or their family have with the regional center. And the service coordinator serves a multifaceted purpose. They are supporting individuals by linking them to services within the regional center or outside of the regional center. So generic resources, as we refer to them, or any service out in the community. Not only are they linking them with these resources, but they are providing education and trainings to individuals and their families so that they themselves become informed of what services are out there, and also so that they can learn how to advocate for themselves and or their family member, so that they can also access other systems that are available through them in their community. So service coordinators are a huge part of the services that one is provided with as you are going through the regional center system. Some of the services that are provided starting as young as 3 years of age. So typically, when we're talking about school age individuals or children, we're looking at children as young as 3 years of age, and it goes all the way up through high school aged individuals. Depending on the needs that are presented and the outcomes and the hopes and dreams that one wants to achieve, they are linked up with the different services that the regional center provides. I've listed a few here, starting with the respite services, daycare services, behavior services, as you can see through the list there. Each service is meant to support, again, the unique needs that an individual and their family are presenting, and specifically to support the individual and the outcome that is outlined in the IPP. And sometimes it may be more than that specific outcome that is on that IPP. It's the things that are meaningful to not only the individual, but their circle of support and or family. And this is where, having those conversations with the service coordinator and really looking at everything from a person-centered perspective, person-centered approach on what it is that they are hoping to achieve is very important. So we just don't provide families with a list of services like the one you see here. Although we do have information to provide the family that outlines all of these services that are available to everyone based on need. It's very important to have those conversations with the families to really look at what it is that, again, one is hoping to achieve, and being able to help them understand what is respite services, what is behavior intervention, what is social skills, so that one is able to really understand how to best utilize that service. Some services require the participation of a parent or caregiver. So the services is really meant, as a training resource, so that the caregiver or the parent are able to gain the skills that would be needed to support the child, and help them continue to develop and grow and mature. And some services are direct support to that individual. So it's really important to be able to, have those conversations and really go through what the needs are of the individual. Some of the services that are not listed here, but are now available due to the recent trailer bill language, are services that were once available, but were actually taken away. So those services have been restored, and those are social recreational services, camp services, non-medical therapies, as well as educational services. The educational services are specific to children between the ages of 3 to 17. And all these services, again, are based on the unique needs that one would present, and through that IPP process. These are additional services and supports that one would be eligible for during the school age years. Being able to be part of support groups and training, again, trying to really strengthen the caregiver's abilities to support the child. Conferences that are related and specific to the individual's developmental disability. And as children continue to grow older, there's very specific services, for example, the self-advocacy groups as well, so that they can continue to be part of a group that they can relate to. Of course, a service that is very important to some individuals is the translation and interpretation of documents and meetings in their preferred language. So that's something that is also a way to provide support and services to individuals. And also there's other supports like behavior intervention, copay, co-insurance, and deductibles. So I'll be talking a little bit about generic resources, but when families are accessing a generic resource like insurance or other services through insurance, they potentially may be eligible to receive copay reimbursement and co-insurance and or deductible. And that's something that would be discussed with the service coordinator when they're having that particular need. I mentioned generic resources. This is another important part of what the regional center does. Under the Lanterman Act, regional centers are payer of last resort, meaning that families or individuals must explore other sources of funding to address the needs that they are presenting with, and try and obtain those services and supports through these generic resources like private insurance, Medi-Cal, in-home support services, special education, and California Children's Services. It is the responsibility of the regional centers to support and guide individuals and families in accessing generic resources. I mentioned earlier that the service coordinators are charged with helping families understand these different systems, helping them navigate these systems, and ultimately supporting them with accessing these services through these other generic resources. And ultimately, if that service or support is not able to be obtained, then the regional center comes back into the picture and is able to fund for those services and supports. Going back to service coordination, I wanted to present this slide here. And this is something that was put together by ARCA along with input from regional centers. I think this really paints a good picture of the different services and resources that are available to individuals and their family. But more specifically, it outlines the job of a service coordinator and what a service coordinator really does, and the knowledge that one is required to possess or find out about, the skills that one would need and attributes in order to be able to really support the individual and their family. If you look within the circles, the different circles here, you see all of the different supports that may be part of the regional center, outside of the regional center, that the service coordinators are supporting families and individuals with. Mental health services is another resource that was not listed, but it is here on the bullet points. Being able to help families access CalWorks, CalFresh, supporting individuals with medical needs, making sure that their pediatrician and or doctors are addressing the needs that are unique to the individual because of their disability. There's all kinds of services here that you can look at, but most importantly also is how the regional center goes about doing all of this, and in particular the service coordinator, being able to communicate well with the families, being able to think outside the box and be creative, and knowing that each family or each individual is going to present with very unique needs, being patient, empathetic, all these different qualities that have to be paired up with the knowledge that one would require in order to be able to support the individual and their families in accessing those different resources, whether it be services and supports that are provided by the regional center or outside of the regional center through other generic resources and avenues. And I think that was it. Thank you very much.
Thank you so much, Cesar, and really appreciate our panelists' willingness to stick around for all three presentations, and then we'll have some time for question and answer at the end. So really appreciate it. Dr. D'Antonio, I see you're back with us.
Yeah, I apologize for that. I had these issues with my internet connection, and I was having some issues earlier today, and it just went out at the most inopportune time. So let's hope it holds on for now. So we'll keep our fingers crossed. I'll share my screen again, and I think that should work. Is it coming up correctly?
Looks great on our end. Thanks.
Okay, great. So we'll go ahead and get started. And so, like I said before, we're going to talk about, the Lanterman Act eligibility for those school-age children. And there we go. So as you know, the regional centers manage two programs, the Early Start program for 0 to 3, and the Lanterman program, which are for people with a substantially disabling developmental disability. And there's the new provisional program that just started, but we're not going to really focus on that tonight. We're going to just talk about Lanterman Act services. And so there's a lot of material on the slides. I probably won't be able to get through all of it, so I'll go kind of quickly in the highlights, and then, if there's extra time, I can go into more detail, or we have, the questions at the end. So I think the important, thing when we talk about Lanterman eligibility is that eligibility is, in regarding the term developmental disability is a legal term. It's a political term that's been created by the legislators of California, and it's defined specifically in the laws and regulations of the state of California. And because it is a legislative construct, in different states in the United States and the federal government as well, all have slightly different definitions of a developmental disability. So it's important to understand that the developmental disability system in terms of the eligibility of individuals is unique to the state of California, and there are slight variations across the United States that is important to keep in mind. Obviously, there's a lot of overlap, but there is also some variation. So there are two components to the California definition of developmental disability. One must have to have one of the 5 named developmental disability conditions, and one must be substantially disabled by that condition. So it's a two-pronged issue in terms of eligibility, having the diagnosed condition, also being substantially disabled by it. And so the 5 conditions in California are intellectual disability, cerebral palsy, epilepsy, autism spectrum disorder, and conditions closely related to intellectual disability. So the first prong is to have one of those, or more than one of those 5 conditions. And the second prong is to be substantially disabled by it. Now, the Lanterman Act gives some further clarification of that developmental disability. And these are kind of important things to understand. The condition needs to originate prior to the age of 18. So I know this discussion is focused on school-age children, but sometimes there may be an individual who later in life has a neurologically devastating event, maybe due to an accident or a stroke or Alzheimer's disease, for example. And although those conditions are quite disabling, if they're occurring during adulthood, they're not considered developmental disabilities. A developmental disability has to occur during the developmental period. And it's supposed to be a permanent condition. So sometimes we'll see children who might have, for example, a condition like a viral meningitis that might be temporarily impaired, but they do get better after maybe a few weeks or months, and they might return to their baseline of function. So even though that child is quite impaired for that brief period of time, that's not considered a developmental disability because it's not a permanent condition. And then that condition also has to be substantially disabling, and I'll get into that in a minute. The regulations exclude 3 types of conditions: conditions that are physical in nature, psychiatric in nature, and learning disabilities. Now it says solely, so this means that if somebody has a completely physical condition, let's say there's a child who lost a leg in an accident, that would be considered a physical, and they might be very impaired by that and need to use a wheelchair. But if that's the only issue with that child, that would not be considered a developmental disability, even though that child's very impaired. But we also have children that might have a physically impairing condition, like a form of muscular dystrophy, for example, that is co-occurring with intellectual disability. So that child could be eligible for us because they do have a physical impairment, but they also have a cognitive impairment as well. They're intellectually disabled. And that also could be the same for certain psychiatric conditions, where if a child is cognitively impaired, is intellectually disabled as a child, and later in life they become have a significant psychiatric condition, they could be eligible for us because they have that prior existing intellectual impairment. So that's an overview of some of the intricacies of the definition of developmental disability. And the other component of that is that an individual has to be substantially disabled by that condition. And the law talks about 3 areas, 3 or more areas, and it's as related to what would be expected for a child of that typical age. So if we're talking about a 4-year-old, we're not going to be looking at the economic self-sufficiency component, because no 4-year-old is considered economically self-sufficient. But that would be a category that we'd use maybe for an 18 or 19-year-old, or a 17-year-old, for example. But in general, for young school-age children, we're looking at language, learning, self-care, mobility, and self-direction. And we're looking at if that child has a substantial impairment in one of those areas. And often that's defined by when we assess the children, we administer standard measures of adaptive functioning, which will give a standardized sense of if that individual is showing significant impairment in one of those areas. And remember, they have to have 3 or more of those areas. So sometimes we might have an individual who has a diagnosed developmental disability condition like cerebral palsy, but they may be very, very minimally impacted. There may be an individual who just has a slight issue with the use of one of their hands, and they don't really have any impairments in any of these areas. Besides, maybe they might have a slight physical impairment. So that child, even if they do have, in this example, a diagnosis of cerebral palsy, would not be considered developmentally disabled or meet criteria for Lanterman Act eligibility because they're not substantially disabled by the condition. And we also sometimes see that commonly with epilepsy. There's some children who have epilepsy that's very well controlled with medication. They take their medications and they haven't had a seizure in 4 years. And it would be hard to say that that individual is substantially disabled in 3 or more areas when they have been seizure-free for many years. So even though they might have a diagnosis of epilepsy, they have to be also substantially disabled by it. So that's an overview of substantial disability. And I briefly put a slide in for reference regarding the provisional program. I'm not going to talk about it in the interest of time, but the slide is there for reference. Now, how is eligibility determined? Well, our statute does give some guidance in terms of the timelines and what's done to determine eligibility. The Lanterman Act talks about a kind of a 2-pronged process called intake and assessment. So, and there's certain timelines in the statute involving both of those activities. So the general timeline is about 120 days to determine eligibility. The initial stage, called intake, is a stage where there's some communication with the applicant about available resources, maybe about the eligibility process, about regional centers. And in that initial period, really trying to establish if the inquiry is regarding a developmental disability and if there's proper consent to proceed with an assessment of that individual. Sometimes regional centers get referrals from third parties without any actual consent from the legally responsible party to go further, and we need to get that consent in order to proceed. Or sometimes regional centers do get referrals for things that aren't appropriate for regional center assessment. Sometimes we've gotten requests for an 80-year-old individual with Alzheimer's disease who might need some assistance. Well, that's not a developmental disability, and we might refer that individual to an appropriate community resource. But once it's determined that there is a suspicion of a developmental disability, there is a process of assessment, which is a 120-day timeline to perform. And in that time period, we look at collecting history of the individual, collecting medical and educational records, which can be very important. Sometimes children have prior assessments through their school district or through outside professionals, which can be helpful in expediting an eligibility determination. And then the regional centers may also conduct their own evaluations with licensed psychologists or physicians to determine if they have one of the 5 conditions and make a diagnosis. And then that information is reviewed by an interdisciplinary team, and the eligibility is determined. Now, I have some slides to talk about the actual conditions, the actual 5 conditions, to give everybody a little bit more information about that. Do I have about 5 more minutes, Amy or Daniel?
Absolutely.
Okay, just want to see where I am on time. So I'll go through this kind of quickly. So I'll give you a little information so people understand what these conditions are. So intellectual disability was redefined in 2013. This condition used to be called mental retardation, and that condition was officially changed in 2013. And it's essentially the assessment to determine if an individual has intellectual disability is done through standardized assessment, commonly known as IQ tests, but there's a various numbers of measures that psychologists administer to assess both individuals' cognition as well as their adaptive abilities, because the definition of intellectual disability involves a deficit in intellectual functioning as well as a deficit in adaptive functioning. So we look at both of those areas through standardized tools when doing that assessment. Autism is another condition that was also redefined in 2013. Before that, there was these conditions called Asperger's and autism, and pervasive developmental disorder. It was all a little confusing for families, especially because regional centers could only make eligible people with autism. But in 2013, this was all changed officially to a condition called autism spectrum disorder. And that change probably expanded eligibility for regional center services because it included a lot of individuals that were previously called Asperger's and PDD before. But essentially, the characteristic of autism remains the same, with the deficits in socialization, communication, and social interactions, as well as having stereotyped and repetitive movements, etc. So there's a variety of characteristics, and you meet the criteria by identifying having sufficient number of these characteristics to meet the criteria as per the formal definition. And how is that all done? Well, psychologists do use, again, standardized assessment tools to make the diagnosis. The most common ways of making the diagnosis is to using both what's called a structured interview, where you ask a standardized history questions, usually of the parent or caregiver. And there's also then standardized observational measures where you put the child into standardized social scenarios, interaction with the child, and the child responds to those social scenarios. So the diagnosis involves both history, getting history of autistic characteristics, as well as observing characteristics in standardized settings. And so those are the main ways that's assessed. Now, the other condition to talk about is cerebral palsy. And cerebral palsy is a little different than those other two conditions because this is more of a medical condition in terms of it is involving an actual injury to the developing brain of a infant, or it could occur prenatally as well, or in the early prenatal and the postnatal period. And there are several different types of cerebral palsy depending on where the brain is injured. And I think one of the take-home messages regarding cerebral palsy is cerebral palsy, some individuals or many individuals with cerebral palsy can have typical cognitive skills, and they only have a physical impairment from the cerebral palsy. But there are also individuals with cerebral palsy who have both cognitive impairment as well as physical impairment as well. Now, you may be asking, wait a second, cerebral palsy, you said, physical conditions are excluded from the definition. Cerebral palsy is an exception because cerebral palsy is considered a condition of the brain that has a manifestation in the body in terms of the musculature, and it is a named condition. So even if somebody is not cognitively impaired, they can be eligible for regional center with the physical impairment due to cerebral palsy. Let's see, do I have more time, Amy, to talk a little more about, there's just a couple more I could talk about.
Sure, a couple more minutes.
Okay, a couple more minutes. The one issue about cerebral palsy, as we talked about, you have to be substantially disabled by it. So, very mild forms of cerebral palsy would not be considered eligible. Most eligible individuals with cerebral palsy use some type of adaptive equipment, wheelchair, walker, braces, etc. Epilepsy is another condition that's quite common, but when we're talking about regional center eligibility, we're talking about childhood onset epilepsy, not epilepsy that occurs when somebody's 40 years old. This is for epilepsy that occurs in children and is present during the developmental period. And it's also a condition that is very common we see as a co-occurring condition with our other consumers. With individuals with cerebral palsy often have epilepsy. Individuals with autism also often have epilepsy, as well as an intellectual disability as well. Now, just having a seizure doesn't mean you have epilepsy. Epilepsy are recurrent unprovoked seizures. In the interest of time, I won't go into more detail on that. And there's several different seizure types, and they're classified by if they involve loss of consciousness or not loss of consciousness. But that being said, epilepsy is a condition that there's very good treatment for epilepsy. Many children with epilepsy, the epilepsy can be controlled effectively with medications. So when we look at regional center eligibility, we're really looking at individuals under epilepsy that have really intractable epilepsy that is really difficult to treat and the epilepsy itself is causing significant impairment and is very disabling to that child. There are certain numbers of what are called epileptic syndromes that we see in young children, be very developmentally devastating to those children. And many children with those conditions are eligible for regional center services. Very commonly, individuals with significant epilepsy also have co-occurring intellectual disability, but not always. And then the very last condition to talk about is conditions similar to intellectual disability. That's probably the most confusing condition. In 30 seconds probably doesn't do justice to talk about that particular condition, but suffice it to say that this condition is one that is a legislative construct. It's not one that you can find in a textbook. And how the regional centers typically interpret this is because it's a condition similar to intellectual disability, we're looking at intellectual disability as a cognitive condition. So these are individuals that have cognitive deficits that are close to the level of somebody with intellectual impairment, but they don't quite meet the formal psychological criteria for intellectual disability, but they're pretty close to it. So that's why there are conditions similar to intellectual disability. And they also have to be adaptively impaired and have those same adaptive deficits that somebody intellectually disabled would. And they also have to have that same criteria to be substantially disabled by the condition. So that's the overview of all of Lanterman Act eligibility in 15 minutes. If people have questions later, I'm happy to address them at the end of the presentation.
That was a lot. Thank you, Dr. D'Antonio. It's a ton to get through, and I appreciate you doing it so quickly to give people such a broad overview of what eligibility and the assessment process looks like.
Thanks. And the internet held out too, so that's good.
Right. It was going to cut out on you again. I feel it. Next we have Don Meza, who is the Director of Adult Services from Inland Regional Center. And while the focus of today's webinar is on school age services, as oftentimes we have to remind ourselves, people are children or school age for much less time than they are adults. And one of the key points in their lives is as they transition from childhood or the school system into what comes next. So without further ado, I'm going to turn it over to Don.
Well, thank you so much, Amy. And I really want to express my appreciation to both Dr. D'Antonio and Caesar for setting the groundwork for me, because basically what I get to talk about is transition, and everything that they have discussed also applies to this age group. But it is an interesting time. So what is transition? Transition is a small window of time that can be defined as the period between childhood and adulthood. In transition, there are approximately 7 years during which we prepare our consumers to grow and become independent and self-reliant. Transition is the jumping off point to bigger and better things. During this period, the doors begin to open for the first time to employment and independence. Success as well as failure are both parts of transition. Regional center service coordinators are not job coaches or job developers, but they do wear multiple hats in order to advocate for their consumers. Transition is the embryonic phase that leads to adulthood. In transition, we encourage consumers to pursue their education to the fullest. Consumers may choose to leave school early, but when they do, they will most likely reduce their options. Regardless, the focus in transition is typically on employment and independence, and consumers are encouraged to try different work experiences and opportunities while they are still in school. As I said, transition is a very short 7-year period where we prompt, push, and encourage consumers to learn as much about being independent as possible. This can be a time when consumers have their first opportunity to get away from parents and to live in their own apartments. It can also be a confusing time for many who are trying to understand puzzling vocational program options, which tend to be emphasized at school around this time. The process of transition begins early with the schools. Progress during transition can be most effective when a partnership exists between the schools, the Department of Rehabilitation, and the regional center. With the transition to adulthood comes responsibility, and consumers can sometimes suffer the consequences of poor behavior. Sometimes the courts can come into play for things like conservatorships and or perhaps sometimes more serious things involving legal problems for the consumer. I know sometimes parents don't want to hear this, but parents can be either a very great support or a hindrance during this time. And oftentimes it's a matter of interpretation. Our goal in transition is essentially to facilitate development from childhood to adulthood. Initially, many or most decisions impacting the child are made by the parents in partnership between the child and their significant others. Gradually, however, decision-making and responsibility shifts more to the adult consumer, but still in partnership with the family and other resources. This transition can often be as difficult for the family as it is for the consumer. Some students successfully graduate from high school with their diplomas. When they do graduate, we try to help them identify and obtain the optimal employment situations and refer them to the supports they need to maintain that employment. Realistically, most teens and young adults are just getting basic exposure to employment at this time. Many of our consumers choose to remain in school until they are 22. In the remaining year in transition, our goal is to make the work experience something positive and productive. If we can create good habits, long-term stable employment will most likely be established in later adult years. There are many challenges that might be faced in transition, and these will be different based on the individual. Variables such as where they live and how much support they have will certainly come into play. It comes as no surprise that the road to employment is most successful when a consumer is fully supported. There are many obstacles to overcome, such as limited transportation, lack of community support, fear and anxiety, and often the consumer's own immaturity. The community can be an obstacle due to poor acceptance and a lack of employment opportunities for the consumer. Inasmuch as the regional center service coordinators try and support the consumers, they can experience mishaps. The service coordinators are available to advocate and support their consumers. They help prompt the individuals to maximize their chances of accomplishing their goals. The service coordinator helps to educate the consumer and their family to the options available and what it might mean for their future. The service coordinators attend IEPs, IPPs, and ITP meetings with the consumer to support them and to help them to glean the most from the services available to them. When a consumer in transition finds that they are on the wrong side of the law, the service coordinator will also be there to support them. The ultimate goal is to help the individual to become a self-reliant adult. The goals during this time are focused on employment, establishing a residence, working out transportation and mobility issues, fostering healthy relationships with friends and family, and ensuring good health of the individual through routine medical and dental appointments. In transition, the service coordinators are involved in exploratory strategies to find the most appropriate options and alternatives for consumers. There are new and innovative approaches to employment, such as incentives to vendors and employers for competitive employment and incentives for work. We will continue to seek out options for the consumers and encourage them to pursue different employment opportunities. The service coordinators will often help consumers seek higher education options as well as other skilled labor options to expand their horizons. We all want to be successful, happy, and safe. We share these same goals with our consumers. They likewise want what is best and most comfortable. The reality is that money is often at the root of the haves and the have-nots. We know many consumers would like to have money for a car, to have the funds for a cool cell phone, but with all of these things, responsibility, budgeting, and good discipline are needed to stay within their means. By the time our consumers reach their 23rd birthday, we would like for them to have a job, to have a place to live, and to be in good health. There you have it. It truly is a challenging age group where the consumer holds the power to choose which path to follow. We can encourage and provide them with options, but ultimately the choice is theirs. As a regional center, we serve transition age consumers by supporting them through their first footsteps to independence. We will continue to work in partnership with the schools, family, and the Department of Rehabilitation in a coordinated effort to transition the consumers to greater self-reliance. Regardless, we must remain positive, be creative, and encourage new thinking. We must challenge the community to be open and accepting. It is too easy to allow things to remain as they are. And we must always remember that every single thing that has ever happened in their life is preparing them for the moment that is yet to come. Thank you.
Thank you, Don. And thanks for taking a really complicated time in people's lives and really putting it in a framework that makes so much sense and really weaves in kind of the role of the regional center, but also the responsibilities of the individual being served as well as their family, because we know it's a team effort to get people from school to work and beyond. So at this point, we're gonna pause for just a moment and see if anyone has any questions for our presenters. If you have questions, feel free to hit the raise hand button, which should be at the top of your Zoom screen. Or feel free to drop a question in the chat. And it looks like we have a couple of questions. Anna.
My questions are in regards to, for Dr. D'Antonio. There, with the change in the diagnosis to autism spectrum and the challenges, one of the things that I was trying to find out is, because your explanation was from taking a child from when they're diagnosed early on before they're 18 through that process. And as we know, that doesn't always happen. People find out, or they know after the fact, after they get out of school or late in life is when they find out that this is available to them. So in those situations, what are the options for individuals that don't have that early records that you were referring to, because it's before 18, like how do you prove that information to the regional center is one question. And the second one was in regards to with the autism spectrum, there's been a couple different, there's people that have gone diagnosed through the regional center and said, received a non-diagnosis, like they're not accepted, and they go elsewhere to a different doctor, more specialized, and they get the diagnosis. So I'm trying to find out, is there a level of expertise that we're looking for at a regional center, or more specific questions or assessments that we need in order to be able to determine that information?
Okay. Yeah, thank you for the questions. The first question regarding over adults, that's a very good question that comes up a lot. The issue is that the developmental disability has to be present prior to age 18. But adult applicants do come through all the, frequently, and we can assess adults, but we're looking for information to establish that that condition has been present during the developmental period. So for example, sometimes we'll have an individual with an adult with Down syndrome come to California from another state, and we know that that condition is something that is present from birth, and so there's no issue with assessing that individual as an adult. And similarly with autism, sometimes an adult comes through and they might have had an IEP, an autism IEP, or there's been testing or issues in their childhood that have brought the issue to the attention. So looking at that history, looking at how they were doing in school, looking at that information is really helpful to help establish that eligibility when we're looking at adults. So oftentimes we work with those families to try to get information regarding the developmental period, even though that information is an adult. And regarding the question regarding when there's a difference in opinion regarding a diagnosis, I would have to say that some of the diagnostic cases are very challenging, and sometimes there requires multiple assessments in different settings to make a diagnosis. And sometimes, people, and also sometimes the presentation, especially for the example of autism, sometimes as the child gets older, in some of the more higher functioning cases, when the social demands get greater as a child gets older, sometimes the symptoms become more apparent than they were when there was a child. So sometimes, having assessments at different periods in life, you can get a little bit of a different diagnosis. So we do have cases that have been assessed in certain, maybe with a regional center, they're assessed in another place, and we will look, at our regional center, we do look at outside assessments, and we do, often accept outside assessments if they're done. There are kind of gold standard instruments that are used in the diagnosis of autism. And I know that at our regional center, all of our psychologists use those gold standard tools in their assessments. And we have very extensively experienced and trained psychologists that do our assessments. They're excellent. And in the outside community, many diagnostic centers also use those measures, but we also see in the community people who make diagnoses without using the gold standard measures. So every case you have to look at, case by case, and look at the evidence and look at what types of assessments are done. That's not a question that there's one answer for everybody. Every case is really individual in those scenarios.
And our next question is from Tamara.
Misty, I said to myself I would be quiet in this meeting. I have a question about the presentation about school services and having nothing to do with the decisions that the family made and their generosity in providing the information about their child who was included during different times of the school time. But I have a son with autistic disorder who meets all the criteria of autism and autistic disorder, and he also has epilepsy. But he was fully included throughout his school years, from age 3 in preschool all the way through. And the presentation did not make it clear that everybody can be included. And I'm such an inclusion mom. I believe that everybody belongs, and that our children don't need to earn it to go to regular education, regardless of how profound their disability is. And I would like some clarity on the inclusion services that can be provided. And my sons were provided in combination of school district and regional center, but how that works for a disabled child who is fully included in school district setting.
So just to clarify the question, Tamara, so I know which of our presenters to send that to, is the question what services the regional center can purchase, or what services can they advocate for through the school district to support inclusion?
Both. Because at least in my case, there needed to be some kind of balance. So I mean, my understanding about the regional center system is that we are an inclusion advocate. We believe as a regional center system, everybody belongs. In some cases, the school districts need encouragement to join our Everybody Belongs civil rights advocacy. In some cases, they don't need that. But the regional center's role in helping a school district encourage full inclusion, that's my question, is who provides that, how it can come along, and how, you know, families can advocate, or how we as regional center board members can help families in our areas advocate for inclusion, should that be the choice of a family.
Okay. So Caesar, I know that IEPs, which is where many of these decisions are made, are really, you know, fundamentally about the individual child. Can you talk a little bit about the role of the service coordinator in helping schools to understand how to support a child who maybe isn't being provided enough inclusive opportunities?
Sure, Amy. And Tamara, you know, you bring up an excellent point, and that is really, for most people, the ultimate goal of full inclusion, whether it be school, your community, you know, where you live, where you play, is to be fully included in everything that you would like to do. Specifically with the school district, yes, it is the service coordinator's responsibility to support families in accessing that particular generic resource, which is the school district. So school service coordinators will attend IEPs and advocate on behalf of the individual and the family for the supports that one would need in order to be fully included into a regular typical classroom. And beyond the support of the service coordinator, there are other services, for example, education and advocacy services. At Westside Regional Center, for example, we have a team of specialists who are specialized in you know, education and advocacy, and are familiar with the educational laws. So these you know, this resource is utilized when families need that extra support. You know, working with the school district to really fully achieve maximum integration. So there are those resources that are available to the regional center in supporting those individuals and families.
Awesome. Thanks, Caesar.
Amy, this is Don. Could I add a little bit to that, just to kind of add a little bit more? And the reason I'm sharing this is that this is a very personal decision oftentimes for families, and we have to respect that. You know, I think our service coordinators are trained to be person-centered, and they really focus on what the family is driving at the time. There are variables that kind of play into this as well. And the reason I asked to speak is that our regional center is in an area where we have multiple school districts that we have to deal with. And that presents another challenge, because oftentimes we have to work within the leadership of those school districts to find that comfort zone to have the inclusion. And the inclusion is a wonderful thing. It works great, you know, when we can manage it. But, you know, sometimes the challenges, you know, are real. And, you know, it's not just the district, but, you know, it can be the community as well as the family not being interested in doing it. So there's a number of different things that can also come into play.
No easy answers on this journey, right, John? All right, and we do want to make sure we leave enough time for the breakout sessions. As Rita pointed out at the top of the presentations, those really are one of the best opportunities that we'll have this evening. But Alicia, I see your hand is up, and you're going to be our last question for the evening before we move on to breakout sessions.
Okay, so my question is for Dawn. You know, my child is a couple of years out from transition, but I know that you were talking a lot about going from school to work. So I guess I have two questions. One is, are there programs that you start initiating in that 16 to 22 timeframe that help guide them towards working? And then the second part of that is what happens if work is just not in the cards for them? Do we just continue working towards that goal and to eventually get it someday, or do we move on to something else?
Great question, Alicia. Yeah, my presentation was very much focused on work, but another major portion of transition is independence, and depending on the individual, and again, it's a very person-centered and personal approach that we have to take, but most of the time we encourage the consumers and the family to look at what options are available at their school and their school district, and to take advantage of all of those things that may be available. Sometimes it involves taking a risk. Some parents don't feel that their child is capable of working, but this is a very perfect opportunity in a protected environment to do work experience or a number of other things that could enhance the opportunities for the individual. And in the end, it may not be the best thing for that person, but at least you tried. And really the focus should remain on maximizing the potential of the individual. And that's something I didn't speak to in my presentation, but one of the most frustrating things that we experience is that the schools will do a lot to provide opportunities and experiences for the students, our consumers. And when it comes to graduating, there are some individuals that would prefer to send their children to a safe and secure spot rather than entering into the community. And the potential goes out the window. And that is one of our struggles. And I think that's what I was touching on when I was saying that sometimes the parents can also be a hindrance. And it's not a bad thing, it's just a reality, and it does come up. So hopefully I've answered your question.
All right. Well, just really want to express my appreciation for our three speakers this evening. In just a moment, we're going to break into breakout groups, and we will have about 15 minutes in those groups before we come back together. And the topic that we would like you to discuss with your group this evening is, what are some things that you heard tonight that you want to bring back to your board for further discussion?